We are families, we are caregivers, we are parents to children with disabilities and medical complexities. We are rarely familiar. We get together to learn, to relate, and to laugh a lot while we share each other's unique family experiences of raising the rarest of the rare. Our goal is to unite, inspire, educate, and empower people living a rarely familiar life. And we're so glad you're here. Hi, welcome to Rarely Familiar. This is Haley, and I'm here with my friends Jen and Trum as we dig into the realities of raising the rarest of the rare. Today, we're going to get familiar with Melissa Winger, author of the book, Who Cares? But before we do that, as always, checking in, seeing how everybody's doing. How's your last couple weeks been? Trum?
I had a good day yesterday. 2 good calls. I met with a Great Day Farm in Northfield. 2 parents built this farm and they made it totally accessible. And so they're trying to get programming, and I had some thoughts on grants to help them. And then I reached out to an organization in my neighborhood, and they created a lending library of cargo bikes. And so it's free for 1 week to trial a cargo bike. And I asked, would you be willing to get some adaptive cargo bikes where people can put their wheelchairs on? And they said, we're open. We're going to start doing some research on that. So I'm excited. So if you ask, people are most willing to help. So as long as I have grant information. Yeah.
I love it. That would be
So
amazing.
that's a good one. Yeah. Jen?
Oh, gosh. Well, I have an 18-year-old who's about to go off to college, and thinking of transitions in life. Yeah, we just laid it all out last night. How many days left do we have? What do we have to get done? What do you have to get done? And there's a lot. And so it's like, but he's going to UC Berkeley in California. So it's a big,
Across the country. Yeah.
it's a big move. It's a big move for all of us. And so, yeah, I really actually am in a form of anticipatory grief. It's going to be a huge change. And having a child, it's interesting. It's, I want to hold on to the side of feeling really excited, and I do, but I'm also feeling the sense of the loss upon me in the quiet house. And when you have a non-speaking child and your oldest speaking, very well-spoken child, very talkative child, leaves, it's like me, Julian, and my dog. Here we are. Yeah. Nobody's talking. So I'm a little bit, it's a lot. So I'm kind of in that space right now. But
not only that, but Kai's been Julian's PCA for the summer. Now, are you going to lose that for the school? I suppose now that he's back in school, things are going to get a little bit easier.
Yeah, so that will shift, and just being a single mom and holding down the fort myself is going to be an adjustment. So I'm just kind of in that space and just counting down every day and trying to stay very present, slow things down. So that's where I'm at. So
transitions are hard no matter what in life. Like, it's a big transition when kids go off to college, and it's your first one and only one going off to college. It's a big change.
It is a big change.
And I meant to offer, I was like, I have friends I think that live close by that he might need a family. So I don't know if you have any family or friends close by, so that way if he needs anything.
Well, it's always good to have a list.
Yeah.
Because I know a couple of people. I have a cousin or two here and there, but they're kind of hour each direction. So we can talk.
All right, we'll talk offline.
Yeah.
Well, what'd you do?
Felix and I went to, and Trum was there, we went to Disability Pride Day at the Capitol last Thursday. So that was fun. It's like a big family reunion with the disability community. I think a highlight for us was, it was like my goal when I got there. I'm like, we're going to meet Peggy. And I was like, and I thought the ship had sailed because she came and she did her intro, and then she was off doing things, and I saw her go back to her office, and I was like, bummer. And then I guess she went for lunch, and she was on her way back, and I was like, score. And Colleen's there with her whole big setup for partners in policy making, and she knew that I wanted to go meet her, and she's like, let's get him out there, get Felix. So we had to move a bunch of tables around and get Felix out on the sidewalk, and he intercepted her. And you can't say no to Felix. And
no, you can't.
And you should probably tell people that she means Lieutenant Governor Peggy Flanagan.
Governor Peggy Flanagan, also in the running for Senate in 2027. So early on in her campaign. But that was a highlight.
That's great.
She introduced the whole Disability Pride Day, and I just think that she's a tremendous ally. So that was a lot of fun. But you guys are talking a lot about transition, and that's one thing that we definitely want to talk about today with Melissa, because she's been there, done that on about everything that we have to talk about. But Melissa is a nationally recognized advocate, researcher, and author whose personal journey raising a medically complex child fuels her mission to make healthcare systems more compassionate, connected, and family-centered. Melissa and I met not too long ago through a mutual friend. Before I gathered the courage to call her up, I creeped online, I looked at her LinkedIn profile. I was like, yeah, we have a lot to talk about. But if any of
Were you
folks are
fangirling her? You were fangirling her
maybe a
little
little bit. Yeah. But
Okay.
I was looking up, I was reading through some things, and then I was like, she's done a lot. I don't know if I can even talk to her. Anyway, I got the courage to call her up. I was a little intimidated. We had a great conversation. Melissa, thank you for joining us today. We're so glad
Welcome.
you're here.
Thank you.
We're so
Thank you.
honored to have you.
So
That's good.
before we start, Melissa, there are two things that we ask. One is, do you have a fun fact that you want to share? And then second is, what is your tie into the disability, which I think we know, but it's good to hear it from your perspective. So if you could answer those two questions right off the bat.
Okay. First one is I tap dance.
Oh,
Ooh. Fun fact, I tap danced as a kid and just recently took it up as an adult, my third year.
oh my goodness.
Oh, fun.
Did
That's
it
a
all
little
come
fun
back
fact.
to you?
No, your brain and your feet, no, the signal is slow, much slower than it used to be.
Oh my gosh. I used to tap dance to Lawrence Welk on Saturday nights. My dad
Oh.
would make pizza and we'd bring our tap shoes down and we would tap with them. That's my last tap dancing stint when I was about 8.
Is it for exercise? Are you really a dancer?
Fun. No, I'm not a dancer. I am in the back row left. So if I don't know the steps, I can just go behind the curtain a little bit.
Nice.
Out.
I love
Do you have to do
that.
like a recital?
Fun. We do recital. We actually compete.
Oh, wow.
We're in competition, but it is just a ton of fun. It literally is just fun, social, and a
I-
little exercise.
Good
I
for
swear
you.
we have to like keep our blood flowing, keep our spirits up, like singing, dancing, whatever we can do to like stay active. It keeps our brains functioning. It keeps us sane.
And to just bring
exactly.
joy and balance. We have so much
Mhm.
on our plate to do all the time. Just to have that kind of release is
Yeah.
wonderful.
Yeah. And then the tie into disability is all over the place. I was very focused early on in the medical stuff and had to tie in the disability stuff. But doing that, one huge thing was the partners in policymaking to the
Mm.
Minnesota Governor's Council for Developmental Disability, because I didn't know the disability history as
Yeah.
well as they do. And I did mine a long time ago. But that was like really the catalyst of saying, wow, people with disabilities, services, all that stuff is in jeopardy all the time.
Yeah.
And it took a lot of people to get us to where we are. And the rights that people with disabilities now have was not an easy feat.
Yes.
Yeah.
And then you have a son that with disabilities too, correct?
Yeah. So my son is now 29. He was born missing half of his 4th chromosome, but he also has trisomy or extra part of the 6th chromosome. There is no kid like him. There never will be, because if you look at chromosomes, not to get too scientific, but you'll never be missing the same number of bands in a chromosome or have the same extra bands in a chromosome like someone else, just because they're so unique and individual. But each of those bands tells your organ systems how to function. And so missing such a huge part of the 4th chromosome left him with problems with every single organ system.
We all 3 have rare genetic kiddos.
And I think what we've learned too is that yes, we have our own unique genetic condition. And I think you say this in the book too. Within our rare community, we're more similar than we are different. And we have a
Absolutely.
lot of the same themes. And then Trum and I were talking earlier, like that just spills right into the disability community too. All of those challenges that the disability community has, the rare community has. And so
Absolutely.
I think the more that we talk, the more that we share, and the more that we cast our net wider,
Yeah.
the more people we can help.
Totally agree. Yeah.
Tell us a little bit about Evan. What are his joy? Fill us in, because we don't know anything about Evan.
I could just talk about this little pumpkin. He is the cutest little thing. He has since day one just loves life and loves people. He is never upset. He's never sad. And this child, it takes him a very long time, but he wears a costume every day, if not more than one costume.
Wow.
So he is a clown. He is a ring circus master. He does this every day. For some reason, on Mondays, he wears a full suit and tie, boutonniere. It takes him about an hour to put this outfit together with the top hat. And then he just comes downstairs and goes to breakfast. And people are like, I love it.
There's Evan. No,
Whatever he's watching. So he's
Go to
Barney, Sesame Street, a musical fan, and whatever he's watching, he turns into that. He's watching, goes to the doctor. Evan's a doctor. So,
Oh, interesting.
yeah.
Yeah, he's non-speaking, but he's very theatrical and uses the
Imaginative.
rest of his body to
Yeah.
speak.
We taught him how to FaceTime. So he has an iPad and it's just the picture of my face or his dad's or other family members. And it is the funniest thing when I pop that screen open. Sometimes he's got a big clown wig on.
Oh my
And
gosh.
it is
He's
the
the
funniest.
joy
I
maker.
love it.
He is just such a sweetheart.
he's a
That's so fun.
Yeah.
I love
And
that.
I'll get calls from the group home that says, I want to bring him out. I'm going to run errands. And he's coming with me, but we're going to go to the bank. And the problem is he's wearing a sheriff's costume. Are you okay with me taking him like this?
yeah.
No, my 18-year-old was like that, and he was on the playground, and he was dressed in a suit and a bow tie, and he was 5. And the kids go, "It's not Halloween," and he goes, "What are you talking about?" And he had a captain's hat on. He's like, he just was in his own world, and even his senior picture, he's wearing an astronaut's costume. So I just think there are some people who find the fun in life, who are joyful, and it sounds like Evan is one of
What
those.
can we
So-
learn from our kids about joy and being present and just like wearing the tutu if you want to wear the
Yeah.
tutu?
He just makes everyone happy and he's happy. And he just giggles and laughs. And every day is singing and dancing. And
And how they
and
deserve
wonderful. Yeah.
like,
Mm.
every opportunity that every one of us have.
So, Melissa, I have been listening to your book on Audible. You're my first Audible experience. I'm doing the trial run just to see if I like it, but I'm so limited on time that I thought, okay, I walk every day. I will listen to books. This is perfect. And I've been really enjoying it. There's a lot there. It's amazing. It's called Who Cares, like we mentioned in the beginning. So it's fun to hear your voice because the voice that I was listening to, I got attached to thinking that was you. So anyways, but good job with selecting it. Amazing piece. It could be your dissertation.
Yeah.
There is so much to dissect. And I think obviously we don't have time today to jump into every piece, but I love how you weave Evan through all the chapters and you make it relatable. Kaylee was saying before, you're providing your story and data. And that combination, it's like whenever you personalize anything, people like can attach to it. So when I give a talk at work or something, if I can tie something in that's personal, I feel like you can just see people sit up and listen and look differently.
One of the questions that we were talking about is you had all this experience and I see you serve on all these advisory boards. What drove you to write it all down, to capture it all?
The first thing was I have read a lot of books about healthcare reform and books that were written by physicians or policymakers, economists, even philosophers. And then I read a subsection of books written by patients and families. And that looked at hope or just their own personal journey and how they got through it. And both of those are huge. And those stories mean a lot. But I was looking for the book that combined them.
Yeah.
And I really wanted to find a story or a book that made me feel like I wasn't alone in the journey and going through the medical system, because there were so many times that I thought, oh, I have to be doing something wrong. Like it can't be this hard. And that was like everything about like the medical system or even patient safety. I thought, my gosh, me and my son must have the worst luck ever. And then to look at, oh no, you do the research and there's a patient safety issue across the nation. And so it was that whole thing about, I want to read this book. It doesn't exist. So I'm like, now I have to write it. And then I think there were people just as I met and telling my story, they're like, you should write a book. And I'm like, yeah. Right.
Did you like take notes? Did you just write into notebook after notebook? Because my son was in the hospital this winter and I have a huge notebook from 3 months, but you have 20 plus years that you're spanning.
Yeah.
And so how did you pull from all of that, going way back in time? So,
I've had a ton of notebooks. Also, I went through all those discharge papers and I would look at things like, I had 3 reminders full and I would go, oh, I remember that, or I remember that.
Sure.
And it was like, oh, okay. And then I just started talking into a voice recorder. telling the story. And then I wanted to then pull the research. And then I decided it was a hard decision of how do you put the book together. Then I just landed on what I thought the inadequacies were in the healthcare system. And I also wanted to look at somebody who's going through a chronic condition, that I'm not focusing on a book just related to hospital care, just related to clinic. This goes through, because you guys know that the disability or the medical condition, that goes to school with your child. Like, it's not separate. It is never separate. I wanted to know, how does this person go from the hospital to home care to setting up an ICU in your bedroom, and it's this education, this story. And then it's like, you're not alone. And also, we still have work to do.
Yeah, that's huge.
This has been my journey, and how my son, things happened to him. We conquered something, some very huge problem, or got through something. And I said, I don't want anyone to go through this. And even if it was some horrible, like, medical error that happened a lot, I was like, this isn't happening to any other kid, any other patient. What do I have to do? It wasn't about getting sort of justice for my child at the time, because I knew at that time, and doing all the research is usually not possible. But I'm like, no, how can I get involved to make sure this never happens to the kiddos that are coming up behind my son?
Yeah. I mean, and
that's how
there
I
was
just
so
keep
much,
taking on.
so much we could identify with,
Yeah.
because I remember having that same situation where there was a issue that happened, and it was a big one. And it took everything in my power to say, I'm not going to file a complaint. I'm not going to sue you. I want to make sure that this doesn't happen again. I want to make sure the parent, in this case, is listened to. When I say he's a difficult intubation, hear me. Because I know, and I've been there, and I've witnessed it. And so I do think we as the healthcare, I feel like I'm in the healthcare industry now, working on the research side. I think they're getting better at it. And just being in research now, pulling in the voice of lived experience, that's huge, right? I think that's where, as we were saying before, that's where pulling story and data together has power, because we get to hear not only this is the why, and this is the data, and these are the numbers and the facts and what's happening, but then tying that to something really personal, that's what sticks in somebody's brain. And that's what they're going to remember when they encounter that situation again. And so I think that was a really powerful aspect of this book, is hearing the story, right?
I think that's what happens is, when you hear a story and it's personal, now it sticks into your memory. Yeah, the power of the story.
I was really struck by how many themes and how many stories resonated to my life and all of our lives of caring for kids and being in the hospital system, and the PCA, the waivers, all the different areas you tapped on. And I think the one story that stood out for me was when your son had a broken arm. They refused to x-ray it.
Yeah.
And I had a similar story when my son was 3, and I knew something was wrong. And they kept saying, if he broke his shoulder, we would know. And I said, a mom knows. And they waited 5 days. On the 5th day, my mom went out in the hallway, because I was just so overwhelmed. And I'm like, something's wrong. I can see it in his eyes. And I know something's wrong the way he's holding his body. And she said, if you do not get him an x-ray, I have a TV show, she did, and I'm going to da 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 da. And about 20 minutes later, they came in, took him out for an x-ray. And guess what? He had fractured his shoulder. And I knew it. The doctor never returned. And so reading this, and so I didn't do the next step. I didn't file a report. I didn't go to that level because I was exhausted and I didn't have the resources or the bandwidth. And so I think I would love to know, because this continued to happen to you over and over, the group home story where there was the assault, and you went through that next step that I don't think everybody has the ability to do. And I'm just wondering, where does that drive come from? Because you are a fierce mama. You're protecting your baby. And we all want to protect our babies, but we all don't have the resources. So like, where do you draw your strength from to continue doing this?
That's a great question, because I am one that is conflict avoidant at all levels. And I am fight or flight. I am always, for myself, flight. Something occurs when something happens to my kid, that it's some transformation, some kind of a bear, where I just have no I have no tolerance for it. And I get so angry only, I think, because my child is so sweet and he's not bothered by it. He's like, I guess I got my broken leg. I'll just walk like this from now on. I'm like,
Right.
no,
Oh,
Devin,
goodness.
no, we're not going to accept it. I think it's just that drive to make sure it never becomes acceptable, especially for a child like my son who is developmentally disabled. There's something about where people think they get a pass and, well, they have so much going on. This is nothing.
Mhm.
That drives me insane. It's like, if I have to defend my child's existence one more time, like, I'm going to lose it. And that's what's been happening, especially as he got older.
Do you mean like he has so many things going on in terms of so many different challenges that it's one more that it doesn't really matter? Okay.
That's their perspective. Words I've heard, like in the emergency room, like just talking at the desk. Like, how about room number 4? What's wrong? Oh, everything's wrong. He's one of those kids. So put them last or something. Are you kidding me right now?
Mm.
It's like defending my child has the right to be here just like everyone else. And it's gotten more so as he's gotten older. And I hate to say this is very sad for me to have to say it, but it's like, as a baby, as a little kid, there was that, oh, look, it's the little kid with disabilities. And everyone's like gushing over him. That person now turns into an adult and everyone's now scared or doesn't understand. It's like, what happens now?
So
There's a shift.
also the drive for me there is that all of our kids are going to turn into adults.
Yeah.
But right now they are cute and they're little. And I think that if we have it in us and if we teach our kids now when they're little to be self-advocates, the ones that have the capacity to, I think it's going to move mountains for not just the pediatric population, but the adults. So the kids are helping the adult. I was talking to another friend of mine who lives with a condition herself. And I was saying, I don't want to feel like, I'm exploiting my, and he is learning how to do that. And you are teaching him how to do that himself. And so I still feel like it's the right thing to do. And we have the opportunity now while our kids are younger to really, to stick in somebody's mind. If it's the story of the little kid or whatever, that's what sticks in your brain, great, because those kids grow up.
Yeah, whatever it is. Yeah,
whatever it takes.
So Melissa, Jen mentioned she didn't have it in her to file the report. And can you help listeners or myself understand what filing a report does to help, I guess, both sides?
And I actually stopped also filing reports because I learned early on that you would talk to, say it's an inpatient stay and there was an issue. You go through the channels of getting a patient or family representative. But then you start to realize that they often work for the risk department of the hospital and may not actually be on your side. So I had to learn all these things. And actually, I don't report a lot of them anymore. I learned that some of the national organizations you report to also aren't that much help. And then also looking at, filing a lawsuit. Well, these are pediatric specialties. I have to come back here next week.
I don't want to be down.
Yeah.
And then that's the trap, right? So it's a system. We want to report it so you understand what went wrong to do the analysis.
But I do think
But
there
then
is
we're
a
trapped
desire.
because we need the specialists.
Yeah.
And there's only so many specialists that probably could do some of the things that they need to do with our children.
There is a desire. And Melissa, I know that you went through the system. It was a long time ago, and you still are, right? But certainly in the pediatric space, think things have or are changing. And I believe, and what I am seeing now is we want to learn from the hard stuff and we want to see what happened and we want people to tell us so that we can create those change. But you have to be in it. And now that there are parents in that system doing the research alongside the clinicians, alongside the PhDs, I believe some of this is starting to truly change. I believe they are listening. And I think you have paved the way for many of us now coming as a quote unquote second generation of disability advocates and of parents of kids with rare disease that we are now finally maybe being heard a little bit more.
Yeah. And that's what I learned. And you'll see a lot of examples in the book of this happened. These are the steps I took. And sadly, though, what you'll see is these steps that I took didn't go anywhere. That we kept getting turned down, but I hope that doesn't discourage people from continuing to go down those steps. But then I always went a step further and said, especially with my child being injured at his group home and the whole vulnerable adult abuse system, is that I went to the source and was like, do you have a committee? What are the rules with the vulnerable? What are the policies? What is it? And I'm like, I want to be a part of it because we're changing this. This is not acceptable.
Well, let's talk about that a little bit. We just had the whole big transition summit. My son is only 8, but I look ahead 10 years and it just terrifies me more than anything else is like what happens when he wants to be more independent. We know what happens from a medical perspective, right? There are certain things that have to happen and there's paperwork that needs to be filled out and there's the guardianship and all of that. But talk to us a little bit about the decision. Of course, he says he's going to live with me forever, right?
Yeah.
What if he doesn't want to? And I have to search for that place to send my child when all I've heard and all week, advocating for is keep kids in their home. What does that transition look like? What did it look like for you?
Yeah, this was a big decision and it was a lot of different factors. And if you think back to what you want to do and what I still want to do to this day is keep him with me all the time. But in reality and the way our society is made up, we can't usually do that. I have to still work full time. The home care shortage is unbelievable. And it's been that way since my son was born 29 years ago. We haven't really improved that home care staffing availability. And if you think of when they're no longer in school, that's a full day of me having to take care of him, not being able to work. There's also a sense of he is his own person. Developmentally, I say he's about 2 or 3, but has 29 years experience.
He's good.
And even though he's sort of that toddler level, he understands a lot more than I think even I give him credit for. But he is non-speaking, severe autism, and a lot of medical needs. So he's a 24/7 cares. And so the other thing that came about was what happens when something happens to me? And that was terrifying. Now is my son going to be pulled from me in a crisis situation, which would be horrific, in my opinion, if that happened. Also, I didn't think it was possible, but I thought he was attached to my hip and he could not live 1 minute without me. But the day came and it wasn't easy. We don't have a system of group homes that is choose where you want to live and who you want to live with. We don't have that luxury here in Minnesota. There's a moratorium on group homes. So there are waiting lists everywhere. So he was on every group home waiting list. And we decided when the decision comes, when one is available, we'll make the decision. That took 3 years before his name came up on any group home list. We went there and we looked into it. And when the time came to say, yeah, I think this is time for him to move, I thought I'd have to sedate him. I did not think he'd willingly.
My goodness.
But the day came, and he helped pack his room. And I'm like, where does he think he's going? Does he think he's going on vacation? We got to the group home. We showed him this empty room and had furniture, but he immediately went and found the sheet in one of the boxes and put sheets on the bed. I'm like, oh my gosh.
He
Oh
knew
my
he was
gosh.
home, his new home.
Yeah. And I planned to spend hours there that first day, orienting the staff, doing everything. And that's when my son, after about 2 hours, gave me my purse and said, bye. And that he can say about 10 words. And he goes, see you later.
Oh my goodness. Oh, that's a sweet
was
story. That must have given you such peace of mind to just
It
go,
did.
okay, he's going to be okay. He's ready.
Yeah. It did.
Well,
And
I
that
might
buddy-
be calling you in a few weeks.
Yeah.
Dealing with the bye mom.
Yeah.
Are you sure? No. But you make a good point because I think about my son is 15.
Yeah.
And if you say 2.5, 3 years, now I'm not wanting to even go there yet.
Yeah.
But there's many reasons. One reason could be that I can't take care of him anymore. He's going to be 6'4" and he's getting big and he has aggression and physical outbursts and there may be a point where I don't have a choice. But the other point that you made is important of what if something happens to me? And I haven't thought about that. And I think that's something else to consider because we think, oh, we'll just take care of them the rest of their lives. But yeah, can you tell us a little bit more about the moratorium? Because I listened to that in your book and it sounds like there are only so many of these homes allowed in each city limits or communities. And so then it creates a shortage. Is there any workaround for that? Because you went into a group home with 4. So what are the options?
Yeah. That's what the group home, they're called adult foster care settings. And that's the setting is for adults. And then the care around that is varies. So my son has 24/7 awake staff. So there are some group homes that have day staff and then they have sleeping overnight. So they're there physically, but it's a sleep supervision. So there's other varieties. And there's also some that need a higher level, which is intermediate care facilities. I think those are homes that can have up to 6 people, and those need a higher level of nursing type care. But the moratorium was designed to make sure that we're putting the correct people into group homes, that we're not putting somebody who could live on a supervised independent in a full-time care group home. So the idea was if we limit the number of full-time group homes with around-the-clock care, then people will really look at the appropriate settings for people. But I don't think after years of this setup, that's happening. So the moratorium means you cannot get a new group home license unless somebody basically closes down or gives up their license. And there's different licenses per, I want to say per city, it could be per county, I'm not sure. But it also tied into this belief that the same group home types, like licensing types, were the same as like the sex offender programs and those step down houses and those halfway houses. And the group homes were in that same category. So there were neighborhoods saying, we don't want this in our neighborhood, not knowing they were eliminating houses for people with disabilities. They didn't realize that was part of this.
It was just group home, just lumped into
It was any type of care.
transitional
Homes with any staffing.
Okay.
And so there was the whole not in my neighborhood kind of protests that were going on. So that eliminated that
just
too,
for
and
lack
that
of
solved that
education.
problem.
Yeah.
%. Why can't we just get a new license type? Just some basic.
Yes.
Can we separate ourselves from that? Because I think people would not mind at all. I have people with disabilities in their neighborhood.
But after the assault that happened at the group home, how did you feel sending him back? What was, I mean, obviously that staff member was no longer there. So did it feel like that shift made it safe again? Because that's my fear. I have a very vulnerable child. So my fear is some form of assault.
Yeah. And I went through with that group home, ensuring that people that I assumed harmed my son, because they wouldn't be very specific and they wouldn't tell me it was a sort of an anonymous thing, even though I could say, yeah, this person that works every single morning. And that's when it happened. So they wouldn't identify the person necessarily. And the group home don't care if you leave. We have 100 people on the waiting list. So to get them to change, to get them to do anything is, well, sorry that happened, and we'll retrain. And I'm like, this person's been working for you like 5 years. I don't think it's a training issue. So that's when I really got involved with the vulnerable adult abuse, because I wanted something to happen, because I couldn't understand how if you or I got injured by another adult, that's assault. And we could file charges against that person. Why is it different for people with disability? And I went down the rabbit hole of calling the police department and calling the prosecutor's office of that county. And because I wanted to learn the process, and they were very honest with me, because they said, we see every vulnerable adult abuse report that happens in our city, and we don't do anything about it. It sits on a stack of papers because no one is ever prosecuted, because the person that was assaulted is an unreliable witness. And I was like, you have got to be kidding me. And this police officer was like, that is exactly what happens. And it sickens me.
The other thing that sickens me is one thing you said about animals and harm to animals executed
On a federal level. So I've made the comparison in my book about you having a service dog. Someone harms you versus someone harming that service dog. If they harm that service dog, they're getting 5 years in prison or $5,000 fines. But for a person, a vulnerable adult, it's 3 years or $1,000.
And Trump had that same issue. There were in the airport, there was a place for dogs to go pee.
Yeah.
But was there an adult changing table for an adult human who needed that to use the restroom? No.
You'll see it everywhere, and it drives. And it's like, my son getting injured, was that the first thing? And then I just go down this rabbit hole of thinking, okay, there's got to be a list of people that they shouldn't pass a background check. They shouldn't be hired. So, because what I found out is that the person did get fired from my son's group home for that incident. He's probably working at a group home down the street.
A different one. Oh, we found out the same thing
What's
with
that?
a school para. They go from one school to the next school. and they were like I don't even want to go there.
There's a list, but most group homes,
They don't do
not
their
check the
homework.
list.
There's a shortage too.
Yes, it's a warm body. Get them in. Get them in.
I didn't mean to aggressively point. Like,
So you would advise if you have a 15-year-old, probably get on a list, whether you think you're using a group home or not. Get on the list. Okay.
There's 3 years before you think you're going to want one.
No.
And I think another important thing to call out is you have the right for yourself to make the choice to not be a parent. You talk about this in the book, to not be a parent for your whole life, right?
Yeah.
At a certain point, your kid is an adult.
Yeah.
And I think
that was hard for me because I got a lot of backlash from,
You know what?
especially I tried to take a year off, 2 years off Facebook because I got some backlash of you put your son there. And I'm like,
It's hard.
Everyone knows
is
until they're
hard.
in your shoes, they do not know.
When we had the dream of having a child, we never dreamt we would have to be full-time nurses. And lifting 100+ pounds is just so hard on our bodies. And so and then you have two people with disabilities because you're trying to help somebody else. And so
Right.
it's just a never-ending vicious circle that I think what your story is telling us. It's the humanization and the dehumanization that is happening in society for the population of people with disabilities. And I think it's very interesting to hear it from, like I said, your perspective of what you're getting as backlash. It's easy for people to come in and make a comment, but they're not living our lives. I do want to take a step back. In your book, could you give us like an like if someone wanted to understand what your book is about, could you walk us through like how you put it together, what's in it, so that people could say, this is a great go-to resource for us if we're living the life of raising a child with a disability?
Yeah, absolutely. So the book also was intended to not only for people to say, I'm not alone, but it was also intended for providers, caregivers, policymakers to say, wow, this is what a person is going through if they have somebody with a chronic illness or a disability. And I start all the way from prenatal care all the way to long-term care with my child. And so I divided up the sections based on what I think are healthcare systems that need improvements and some of the issues that we've had. So it starts out with patient safety. And I talk about all the patient safety issues. And I start out with personal stories of this is what happened to my child. This is the journey we were on. But then I wanted to back it up with research on it didn't just happen with this hospital and this doctor or just my son. It is happening across the country.
Okay, can I just kudos to you for a second? I've got this book in front of me, and I work in a research department. These are key. These other papers that are we're talking about 16 pages of references.
For sure.
You've
You did
done
the
your
homework. That is for sure.
Yeah.
Yes.
And I think that is key. We cannot just tell these stories without grounding it in evidence. And
That's what I have
that's
to
what
do.
you've done.
Yeah. Because I knew of some things, but I'm like, why do I know that? Why do I know the moratorium? How do I know that? So then I had to dig back and go, okay, where's the law? Where's like the
Right.
statute? And had to really go back to get the actual evidence.
Yeah.
So after
but yeah.
patient safety, then you touched on what other kind of key areas?
Oh gosh, I went through the whole vulnerable adult system. I talk about emergency medicine because when you have a chronic illness, you want that. You want 911 and you want to be able to have that.
It's broken up to chapters, right? And I
Right.
think you can take it in chapters. And I think
Oh, yeah.
this needs to be part of a med student's curriculum. This needs to be required reading, I think, for not just med students, people, practitioners, everybody. I think it just gives the big picture of what you encounter and the challenges that you are faced with from the very beginning in the NICU all the way up. And I think it is remarkable. I think you've got it sitting behind you, but for those
I have it
on
everywhere,
YouTube,
actually.
yeah, it's
But-
great. It's great. And is that you on the cover?
Yeah, because that's
my
my
gosh,
thing is I'm 18.
Yeah, you're in
So, and
So
it's-
we can find the book all over the place, Amazon,
And
local
Barnes and Noble.
bookstores.
So you
But-
were just how old when you had him?
So pregnant at 17, I had been 18. Yeah.
Okay.
And I didn't have any family support or, yeah. Oh, yeah.
The fact that you are where you are and
Yeah.
have overcome all of that. Congratulations. It just what you have done, what you have accomplished, looking at your list of credentials is just remarkable.
Yeah. Thank you. Because I don't even have the education background. Everything that I do is based on experience. I don't have the PhD. I'm not a nurse. I'm not a doctor. I talk about that in the book is I'm expected to run feeding pumps at 18 years old. I'm like, man, I was a C student. Ridiculous.
But you have it in you and you're very self-taught.
Yeah.
Yeah, it's very impressive. So,
But I do believe there's beginning to be more value added to that perspective. And if there's any hope we can instill in the population that we're starting, let's get this in the right hands and all the universities out there.
I love that. And I don't want anyone to think that the book also focuses on the burnout that providers, and the book's not even against the healthcare system. It's like none of us are winning. None of us are happy with this. And let's all together. It's not I'm not against anybody, and it's not anyone's fault. It's just this circle of issues that just makes it so it doesn't work. And I feel like we're all not in a good place, even the providers at this point. Yeah.
So then, Melissa, what's next for
I
you?
really am focused on the long-term care aspect of things. It's terrible. I think what happened during COVID to people in long-term care, they weren't treated like humans. And other countries don't face this. Their societies are set up to the grandparents help with the children, and then the children help with the grandparents, and you move them into your houses, and you have communities. And the U.S. isn't set up that way. And it's unfortunate, but I think our long-term care system is something that is, we don't talk about it enough.
So would now Evan be considered in long-term care because he is in a facility and it does have assisted? So he is now considered in long-term care. Is that right?
I was going to ask the same thing. Like,
We don't think we grow up thinking long-term care is when you get really sick or you need a nursing facility. But in our kids, they just have evolved into that much earlier because of their needs.
Yeah. And then assisted living, it's like all of that out-of-home placement for cares is basically what long-term care is. And I also hate to be in this position because as you guys are facing, when my son was younger, I'm not going to worry about it. It's going to be fixed by the time he gets older.
Not with all the changes that are happening.
Yeah. What happened? Nope, didn't change at all. And they have staffing shortages.
Yes.
Well, our country, it is. Julian's driver, he has a driver to bring him to him from therapy. He said to me, what is wrong with this country? So he's not from here, clearly. And he said, because you should not be caring for this child alone in the house. Where are all your people? Where are your family? Where are your community members? Like, our system is set up, we're so individualized, right? And so how can we shift that with the healthcare system? I don't know, but it's definitely something to keep thinking about. And you gave us lots to think about.
Fantasies of getting to just building a community with people. I look at small towns and they don't put their loved ones in. They're like, the community, Bob's going to check on so-and-so, Susan's going later. You just,
It happened.
That takes care of each other. But we don't really have that, so.
Yeah, let's start. I have a house.
Can we start a commune?
Like, fill my house.
Big project to do here, ladies.
We have a big project. Thinking about all of your experience with access and disability rights and shaping systems, those of us who don't have that experience, what kind of advice would you give for parents and caregivers to advocate more, to bring change, bring joy?
Yeah, this was something, and it's not even about even advocacy, because it was something I didn't do that I deeply regret. And I was so caught up in all of his medical conditions, and I didn't enjoy him. I didn't have all the baby pictures and the kid pictures. I don't want pictures of tubes everywhere. And I regret that. I didn't enjoy him as a kid. I was so hyper-focused on this medication and this piece of medical equipment that I didn't enjoy him just as a child, as a kid, and just the mom and kid thing. And I really wish even people that are taking care of any loved one, enjoy that time, whatever it is, doing puzzles, playing cards, enjoy the time you have with them.
People say that, but it's hard when you're in it and you have someone tells you that, just enjoy your time. Like, what? It's hard to understand in the moment what that really means. But it's like, I think if I could translate that to my former self too, I would just skip PT just have a day, like play hooky, like every once in a while, just drop everything.
It is.
And give yourself grace. Give yourself grace for
Take
being
time, all
exhausted
the
and,
time.
and not being able to do it all, right?
Because looking back, I would say the same thing. When I found out all of her diagnosis, and then I was doing PT, OT, SLP, and I was like, this kid's half asleep. Am I doing this for me or am I doing this for her? And then I was like, we're just going to take a break. And so I think that just made me less stressed. And so then I was like, all right, now I can just let her do music and let's go to a concert because she loves music. And I think it is true. That is a great word of advice from, someone who's now 29 years. Is that how old Evan is?
He is 29. And I let the stress of taking care of him every single day, and this, I talk about it in the book, it affected my health at the age of 20 and developed a heart condition because I didn't allow myself to breathe. And I still struggle with that to this day because I feel like my child's survival is all dependent on me. And you take that on and can be very detrimental to your health. And I still struggle with it every day. But you do have to take
But
care of
yeah,
yourself.
self-care. I know in the book you talked about not wanting to leave his bedside. And I think we can all relate to that. It's this, I can't eat, I can't take time. I'm afraid of something happening. But we do have to find ways to step away, to eat,
It's
exercise.
like the airplane, right? When the masks drop, put it on yourself and put it on others.
Yeah, absolutely.
I'm probably not going to do that, but yeah.
Like realistically, if it happens, are you gonna put on your own oxygen?
Yeah. Oh, yeah. I am.
We'll
I am.
remind you. We will remind you.
We're on a plane together.
Out as you're trying to. So you need to get that kid off the plane.
Thank God.
No, I don't know if it would really even click in that moment.
No. Yeah. And you don't have to fight every day. I literally say this. It's like, why do we go into these situations having to fight? That drives me insane. You're at your weakest moment and and now you have to fight. And we're going to change. And it's people like us and it's the listeners, everyone. Spread the word. We're going to make it better for our loved ones and the people coming up behind us.
Little bit by little bit, like the ability to share these stories more widely and the ability for people to make that connection and hear them, I think is finally there. We don't all have to sit down and read a book, right? If that's not our platform. If we want to listen to it, if we want to get a snapshot of it on a podcast, we can. If we want to do short form content in social media, we can. But there are all different ways to share those stories. And I think it's going to snowball in a ways that it hasn't before. So I do feel hopeful.
Thank you guys so much for having me.
Thank you so much. If you liked today's topic or have comments, questions, or thoughts on what else you would like us to cover, please visit rarelyfamiliar.com or connect with us on all the social channels. Resources will be listed in our show notes, and we'll be back next time with another discussion around living life successfully with rare medical complexities. Thanks for joining us on the journey.